Of all the lies told in public over the past 10 years, and there are almost too many to count, this may be the most painful of all. It's almost hard to watch, but we're going to play it anyway. Remember this?
Make your plan to get one of these vaccines. They are safe and effective.
If there's one message that needs to cut through all this, the vaccines are safe. I promise you, they are safe and effective. Listen to Dr. Fauci.
When we say that something is safe and effective, we mean it's safe and effective for everyone.
Our vaccinations against COVID-19 are safe. They are effective, and they're more important than ever.
This vaccine has gone through the necessary and rigorous evaluation that ensures the vaccine is safe and highly effective.
Of course, they were neither safe nor effective, and that was obvious right away as people who took the vaccine continued to get COVID, and more ominously, as some of them began to die. And a lot of them, probably people around you, got sick in ways that no one anticipated. Anyone watching this carefully and watching it at all would know both of those things, and yet most physicians in this country lied about it, continue to lie about it, and to this day lie about it. That's the topic of another show. But today, we'd like to introduce you to someone who bravely told the truth, regardless of the cost, to himself personally, and that's Dr. Pierre Kory. He's the President and Chief Medical Officer of the Frontline COVID-19 Critical Care Alliance, and he joins us now. Thanks so much for coming on. And the point is really not to resurrect an incredibly painful moment in the country's history. It hurt even to watch that. Why are these people in jail? But to assess the cost now. So you hear, and one of the reasons I'm so grateful you're here is because I think you're a responsible science-based person who's practiced medicine for decades, and what you say can be trusted. Do we have any real sense of what the cost, the physical cost, to the country and world has been of those vaccines?
I do think we have some understanding of the cost. I mean, I think you're aware of the work of Ed Dowd, who's put together a team and looked analytically at a lot of the epidemiologic data. I mean, we have estimates for how many people have been killed. We have estimates now, pretty precise estimates for how many people have landed on the disability rolls. And all of those deaths and entries onto disability are timed with the onset of the vaccination rollout. And all these discussions about alternative explanations for why that might be, they all fail because you cannot argue against the temporal association. I mean, time with that vaccination rollout is when all of the numbers started going sideways. The excess mortality started to skyrocket. The disability claims started to skyrocket. So it's an immense cost, Tucker. I mean, we can be precise, but
well, give us a sense. Like, if you were to, and on the conservative side, trying to be as responsible and fact-based as possible, but like in this country, what kind of death toll are we looking at?
So just the most kind of alarming data that I've been writing about is just in 2023 alone, in the first 9 months, we had what's called an excess mortality of 158,000 Americans. Now, that's compared to baseline death rates in this country to before the pandemic. But this is in 2023. I mean, we've had Omicron now for 2 years, which is a mild variant. Not that many go to the hospital. When you look at what's driving those 158,000 deaths, and by the way, that's more than all wars since Vietnam, including Vietnam. That's more people dying than we've lost in wars.
In 9 months.
In 9 months of 2023.
Vietnam took 11 years.
Exactly, in 9 months. Now, all of that 158,000 is not all from, let's say, vaccines. There's a portion that is from COVID. Obviously, we have other societal ills which are troubling us. We have a drug epidemic. We have deaths of despair, but those are actually pretty well accounted for. And
those have been going on for some time.
Exactly. You can't blame all that. Like fentanyl did not just arrive in this country in the third quarter of 2021. And even more troubling with the data is who is dying? It's not the elderly. I mean, our life expectancy in this country dropped by 3 years in a span of 3 years. Now, who has to die arithmetically for that to happen? Young people. And what the data is screaming is that it's not only the young people that are dying, but they're the healthiest and most employed. So the employed is a risk factor for death now. And so you're left with a conclusion looking at this data. You're left with two big questions. Why was there an explosion in explosion in dying in the youngest and healthiest sectors of society? And why did the employed fare far worse than those that weren't? And it's particularly white collar. White collar more than gray collar, more than blue collar. And so you're left with the question.
Wait, fared worse?
fared
That's
worse.
the opposite of what you would expect.
100%. So why is the healthiest, most educated, wealthiest sectors of our labor force dying at higher rates than those that are what are called gray collar, like cops and teachers, versus blue collar? And you have to ask yourself, what happened in the American white collar workplace?
That's crazy.
Never. This is unprecedented.
Because that's the healthiest segment of society. People who are dragging
always have been.
themselves out of bed every morning.
Always have been. For very good reason. They tend to be the most educated,
Yes.
employed, wealthy, and so generally the healthiest. They have all the risk factors.
Fittest, best food.
100%. Exercise, and that's what my practice is full of today. Is formerly really successful, healthy people who are now effectively disabled.